The Ministry of Health and Welfare has announced it plans to increase the number of medical students by 2,000 next year in a bid to address the chronic shortages of doctors in rural areas and the essential healthcare field.
보건복지부는 지역의료와 필수의료 분야의 만성적 의사수 부족 문제를 해결하기 위해 내년 의과대학 입학정원을 2,000명 증원한다고 발표했습니다. Okay, so what's the overall number we're looking at here, I wonder?
So they say that the quota for medical school admissions, it's going to expand by 2,000 or 65.4% of this year's quota. So they're announcing that they are going to expand the quota to 5,058.
Right.
And this is for the first time since 2006.
네, 그렇습니다. 그러니까 내년 같은 경우에는요, 의대 입학 정원을 2,000명 늘려서 5,000명이 조금 넘는 정도의 입학 정원으로 가겠다는 거죠. Tell us more.
Right. So they announced this measure, but it is expected to draw a lot of protests from doctors. Their claim is that establishing public hospitals and offering better salaries would be more effective to encourage doctors to work in these rural areas or the essential healthcare field. And by essential healthcare field, you know, we're talking about internal medicine. They say there's a shortage of surgeons, like neurosurgeons. Because a lot of these young med school graduates are choosing to work in dermatology or, fields that are considered non-essential. So they said the KMA, it's the Korean Medical Association, which is a lobby group of doctors, they're warning that it would launch a nationwide strike if the government, without any discussion with them, without, negotiations, if they unilaterally push for the raising of the medical school enrollment quota. And Korea has been facing a shortage of doctors in these crucial areas. As I mentioned, medical professionals, they tend to practice or want to practice in these non-essential areas because there's lower risks, so lower, chances that you'll get sued by someone. And then they say that because we're also an aging country, the demand for emergency care and the essential care has surged in these past few years.
It looks like the Korean Medical Association is saying, you didn't consult us.
Yeah.
This is
You're kind of just doing this on your own.
Unilateral decision from the government.
Yeah.
And so they are in many ways against this. Let's have a look at the first expression. In a bid to do something.
Right. So you can use this expression in a bid to do something when you're talking about, your efforts to do something. So in efforts to do something would be a very similar expression that you could use instead.
네. In a bid to do something. 무언가를 하기 위해서라는 뜻이 있습니다. 그래서 to do something으로 대체할 수도 있지만요. 이게 조금 더 공식적인 느낌이 있습니다. 자, 그다음에 chronic.
Right. So chronic, when you're talking about a chronic, like a problem, it means it's a long-lasting and difficult sort of problem. You can also use chronic when you're talking about illnesses.
Yeah.
If an illness persists for a very long time or if it keeps coming back, like back pain or neck pain, a lot of people have because we use our computers all the time.
Yeah.
You could call it a chronic back pain or chronic neck pain.
네. 만성적인 질병들, 그냥 계속해서 허리가 늘 아프다라는 얘기를 할 때 I have chronic back pain 할 수도 있고 I guess you could say the same for headaches or insomnia, things like that as well. If it just goes on for a while. 만성적인 무언가, chronic라고 합니다. Okay, here's the headline again. The Ministry of Health and Welfare has announced it plans to increase the number of medical students by 2,000 next year in a bid to address the chronic shortages of doctors in rural areas and the essential healthcare field.